This is 99.5 FM, 103.1 FM, WIKQ, and 95.5 FM, WSMG, The Jewel. We're on the air this morning speaking with Greene County Mayor Kevin Morrison. Good morning, Mayor. How are you today?
Good morning, Ron. How are you?
Good. Glad to have you in today. Wish it were under different circumstances, but, we talked earlier today, and I kind of felt, and I think you agree, that it's important to get some information out to people. There's so much going on nowadays. With the coronavirus, COVID-19, information seems to change on a daily basis.
Yes.
And yesterday, the governor had two executive orders that will impact how people go forward from here. But we want to talk today about exactly what that impact is, and that some of it, most of it, I think people are already starting to do.
Yes.
So let's first, Mayor, talk about the safer at home order that the governor enacted yesterday, and basically what does that mean for people?
Well, the governor's executive orders, there were two, Executive Order 21 and 22, that built upon the previous executive orders that the governor's already issued. This one is a safer at home or stay at home order by the governor to only travel and conduct essential or absolutely essential errands that people have to do. We've been advocating that for the last 9 or 10 days here in Greene County, with Greene County being the first county in East Tennessee to actually declare a public health state of emergency on the afternoon of March the 20th, with the discovery of our first confirmed case of COVID-19 here in Greene County. That's been followed up by two supplemental orders trying to prepare the people and the public for perhaps more stringent measures, graduating up, if you will, as the seriousness of this virus and the response is necessary. But the governor's order essentially orders folks to stay at home. There is a mechanism inside the document for folks that don't comply, to rate it as a Class A misdemeanor. Most of the questions that I've had put to me, either by social media or by email or even phone call at the office, have dealt around what is essential versus non-essential.
All right. And I've got the orders here, and I want to talk about that as well.
Sure.
About what is essential and non-essential. But the safer at home kind of builds upon the federal orders to avoid crowds of 10 or more.
Yes.
And to distance yourself by 6 feet. It certainly enforces and I think enhances the practice good hygiene, wash your hands, avoid touching your face. But it kind of goes a step further in saying, if you don't have to visit family members, you probably shouldn't at this time. It doesn't. I think the governor said, he stressed, this is not a shelter-in-place order. This is not you cannot go out of your house and we're going to be patrolling the streets. But it's you better do these things now so that we don't have to do that. Is that right?
That's right. This is not a police state. We're not an authoritarian regime. Mayor Daniels, myself, any of the municipality mayors or governments, jurisdictions, aren't using this as some type of governmental power grab or some form of something such as that. And I will say, in free societies like we have, with a tremendous amount of liberty and freedom of movement, managing these crises and disasters are very difficult for civilian authorities.
And I think the timeline is something that's unfamiliar also. So, we've had tornadoes, we've had floods, we've had other disasters where there had been restrictions on where you could go and what you could do. But those last a day or two or maybe a week. When the tornadoes came through, you couldn't go past the 107 crossroads for about a week till that area could recover. And you're talking about something now that's a longer timeline than just a few days.
Yes. And another thing that makes it very difficult to get people to understand and grasp the seriousness, Ron, is the fact that this is an invisible threat.
Right.
The tornadoes can be defined by boundaries and things. I mean, that is visible damage and threat and destruction that you can see. This is not. This is very much invisible on door handles, gas pump handles. I know that there's been research and things to decide whether this can even be airborne or not, and I certainly don't want to start any rumors or anything like that. There's a lot about this particular virus that's unknown. What is known is that it's never circulated in the human population before. There's very little, if any, natural immunity to this, and to certain populations it has been proven to be very deadly. One of the rumors or myths circulating out there is that that the mortality or lethality rate is not as great as the seasonal flu. As far as sheer numbers, that may be true at the moment, but this has been proven to be lethal, 10 times in the amount that the seasonal flu is.
And I think one thing that we don't know, or you can't talk about right now because of that, I think history will record this a lot different than living it. And by that, I mean, we don't know what the mortality rate is. We don't
That's
know
right.
how many people have been, and there's people say, well, I had such and such back in December. I think I already have it. And that may, in fact, be the case. But nobody knows right now. And without that knowledge, because this is Dr. Lewis, I thought was very interesting, that spoke to the county commission.
Yes.
He said, it's called the novel coronavirus because it's never been seen before.
That's correct.
So it may behave differently. And you don't want to be on the wrong side of that decision.
That's exactly right. I would rather err on the abundance of caution as to proceed without any. And the other thing that you mentioned obviously is that testing now is beginning to become more prevalent.
Mm-hmm.
More rapid testing is being developed and pushed out to the localities like Tennessee and Greene County. So the number as it stands here in Greene County is 12 confirmed cases, with again a number of cases being tested by ballot and private labs in the Tennessee Department of Health. So a lot of those tests are outstanding and pending confirmation or denial, but that's just a number. So as we become more available, as testing becomes more available, and we're able to more rapidly test and screen people and confirm or deny the results quicker, that number is going to change. It's likely to increase and go up, and which it's not necessarily a good thing that the numbers go up, but it is a good thing that we're able to more rapidly test people, so that we can identify sort of this silent or invisible threat and know where it is.
The Tennessee Department of Health publishes the numbers daily on how many people have tested positive. I think it's interesting to note that they do include in there the total number of tests. And when you talk about people getting tested, that's the smart thing to do. Right now it's only about 10% of all the people that are getting tested are testing positive. So they are administering a lot of tests that need to be done. But I imagine at some point they're also, and this would be something probably for somebody in the medical profession, there may or may not be a need to test me depending on what I call in and report my symptoms as. So, the number there that they put out daily has some asterisks that go along with it, but it's still the only thing we have to deal with right now. So that's what we move forward on.
That's correct. I know, and that's an excellent segue into yesterday. The National Guard members, medical personnel from members of the National Guard came to Greene County to reconnoiter the Greene County Health Department, as there will be a screening and testing station
Right.
that will go into effect from 9 to 11 a.m. Monday through Friday, beginning very soon. Not certain if they're going to have that up and running today, but in order to be tested, you must meet the criteria for screening. And I've got three numbers here that I was
going to ask if you had those because I just pulled them up. So
that
yes.
I would like to publish on the air if citizens again should contact their primary care physicians or one of these three institutions to determine what how they should proceed if they meet the criteria for screening and then later testing. The Northeast Tennessee Regional Health Office, their number is area code 423-979-4689. That's the Johnson City location for the Northeast Tennessee Regional Health Office. Again, that number is 979-4689. Ballot Health is doing screening and testing as well. That number is 833-822-5523. Again, the Ballot Health number is 833-822-5523. Or you can be screened and tested at the Tennessee Department of Health, and that number is 878-857-2945. Again, the Tennessee Department of Health number, 878-857-2945. And the screening and testing location here at our local health department on 11E, there below the theater, will be up and running very soon. This is not a location where people can just pull in and be screened and tested. You must call one of these numbers prior to that,
Right.
and they will give you an appointment to go to one of these 3 locations to be screened and then tested if you meet that criteria. So we're asking people, not to just show up en masse, treating this sort of like a drive-through type thing. You must meet the criteria in order to be tested. So call one of those 3 numbers at one of those 3 institutions to see if you meet that criteria.
We're speaking this morning with Greene County Kevin Mayor Morrison about the orders yesterday, the executive orders from Governor Bill Lee. And you talk about the screening process. Ballot Health, in addition to that, Mayor, has online. You can go through and you put in your age and what your symptoms are, and they ask you, do you have fever, chills, sweating, difficulty breathing, new or worsening cough, sore throat, aching throughout the body, vomiting or diarrhea. Then they ask, do you have any pre-existing conditions that could add to that, including congestive heart failure, cirrhosis of the liver, and others. Have you traveled internationally in the last 14 days, or have you lived in an area where the COVID-19 is widespread? And then, they'll say, yes, you should, or no, you shouldn't. Call this number.
Yeah.
So there is a screening that goes through. Greene County Kevin, Mayor Morrison, our guest in the studio this morning. The president's order that came down at the end of April that was echoed yesterday by you and Mayor Daniels and by the governor stated that work at home whenever possible, avoid social gatherings of 10 or more, avoid eating or drinking at restaurants, bars, food courts. Instead, use the drive-through, pickup, or delivery options. Avoid discretionary travel and social visits. Avoid visits to nursing homes, retirement homes, long care facilities, and avoid close contact with people that are sick, and practice good hygiene. Now, a lot of that has changed since that presidential declaration, because now the hospitals, nursing homes don't allow visitors, and that's, I think, kind of what was stressed yesterday, that safer at home means that some of those things that you could do, you can't. And then he got into the essential and non-essential businesses, and I think that's probably the thing that people were the most interested in.
Yes.
And let's talk first about what the governor classified as non-essential businesses. In his list, in Order 21, included but not limited to, so there could be others. It's basically services that perform close personal contact with the public. And he included barbershops, hair salons, waxing salons, threading salons, nail salons or spas, spas that provide body treatments, body art facilities, and tattoo services, tanning salons, massage therapy establishment or services, and recreational gatherings or venues such as nightclubs, bowling alleys, arcades, concert venues, theaters, auditorium, performing arts centers, racetracks, indoor children's play areas, adult entertainment venues, amusement parks, and roller ice skating rinks. As far as non-essential, I think most of those, Mayor, had already taken those precautions. I know the movie theater had closed. The Impact has canceled different shows. I think the restaurants knew, and the bars had all closed down. So a lot of that had already gone into place. So the non-essential business impact isn't as great as maybe it sounded, but it is going to impact barbers and hair salons, and I think we're all going to look a little bit shaggy, here in a couple of months. I can't get my high and tight.
That's exactly right.
So as far as non-essential businesses, are there any others that fall under that category, or how that will affect the public?
Well, and you mentioned, gym and fitness facilities, which was closed by Governor's Order number 17.
Right.
That also made dine-in options prohibited at restaurants. And I think it bears reinforcing, for instance, or reminding people, restaurants and the like, that that Order 17 essentially prohibited the dine-in options or on-site food consumption. So patrons are asked to use drive-through options, curbside pickup, or delivery options, and that they're to take their food and not eat on premises. So I know that there have been a number of cases here locally where people have gotten their food and they stop and eat it at picnic tables or on the porch type thing, and that's absolutely positively contrary to the governor's order. So but for the most part, I will say that's pretty much the list of non-essential businesses, or what would be considered non-essential services. Again, providing sort of close contact or social visiting type deals, like with arcades and amusement parks and bowling alleys and that sort of thing. But the list is quite extensive and exhaustive for essential businesses, and I think that creates a lot of confusion, Ron, in a lot of people's eyes. I know that the Department of Homeland Security, we're blessed here in Greene County to have a very large manufacturing industrial base, and a lot of those businesses are absolutely critical to food supply, agriculture, national defense, and the like. And so there's a lot more business and industry that's essential,
right,
that would be allowed to continue to operate even under this stay-at-home, or, for instance, a more stringent lockdown order, by virtue of what they do and what they manufacture, whether or not they're downstream, for instance, of the parent company. Again, I referenced John Deere in my remarks yesterday in our press conference. So there's a number of industries and businesses tied to them downstream of their final product that would be considered essential. We're also asking the essential services, the essential businesses that are listed in the governor's order to do all those things within the CDC guidelines that's practicable. The social distancing, hygiene and sanitization to the extreme. One of the most effective things that I've seen is to screen employees as they come in, or even screen customers if they're still open to the public when they come in. Asking simple questions about and being prepared to answer them truthfully as to whether or not, for instance, those folks are sick, they feel sick, they've been sick, they're running a temperature, and to the extent that people can. If you're sick, stay home. Whether you're working in an essential service or not, if you're sick, stay home. And that's something that's relatively new and to us, because as a general rule, if we sort of feel bad, we, as a general rule, again, power through and man up and go do our duty. And we've got to think about that in this virus much differently in that aspect.
So the governor's order 22 that talks about essential services, just to give you to give our listeners an example, it doesn't bar worship or attending weddings or funerals, but what it does say is that you should follow the healthcare guidelines to the greatest extent practical. You can, you certainly want to grieve with your family for a funeral, but if you're not feeling well, you shouldn't attend that. You should, you're probably not going to have a 200-person attended funeral or a wedding like that. Those things are still allowed. You can't ban people from getting married, but you can say you can't have it in a church with 350 people in attendance and have a full catered reception afterwards. So there are some adjustments, although certain things are still allowed.
Yes, and I think that those adjustments are the thing that are hardest to get used to.
Yeah.
And we're used to, again, being a very free and open and interactive and social society, and with this threat and the fact that it's invisible, we've got to start thinking about how to do things differently. So it is uncomfortable for us to think, for instance, that if we have a loved one pass away, that we can't, have all of the friends and relatives that normally gather at these events, and that that is somewhat very, very heartbreaking and sad to our psyche. And but it is the circumstances that we live in, and in order to protect, for instance, those most vulnerable, these are the things that we must do. And I know one of the things that at least I took action for and published to the Greene County government is I want the government to observe the same rules and procedures and policies as we're asking the public to do. That's one of the reasons we closed all of the facilities in Greene County, was to set the example, not to take days off of work, but to say, Greene County government is going to take and be the example for the things we're asking you to do. So we're not conducting meetings en masse.
Well, that's the thing, Kevin. These things can be done in different ways. There are teleconferences. As far as the funerals and weddings, the governor says, if you're going to have that, please only have the close family attending. And I know that the funeral homes are making those arrangements too. And the as far as weddings and things go, I think a lot of people will say, I really love you, I want to get married. Maybe go ahead and do it with the preacher, and you've got your distance, and we'll have a celebration when all this is over with. It's not a banning of this. It's just these things need to kind of take a back burner for a little bit on how many people can gather together. And you talked about the list, and I want to go down. It is an exhausting list of all the things that are, or it's an extensive list, I should say, of all the things that are considered essential. So we'll just kind of hit the headline of each of his paragraphs without, we could talk about each one of these for 15 minutes each. But first, healthcare and public health operations. That covers hospitals, the people that work at hospitals and cleaning, sanitizing their staff. Things that need to make the healthcare system run. The health department, doctors' offices, those things are still allowed to be open and function. Again, all this comes under the umbrella of practicing the good health guidelines.
Yes, and it's fairly reasonable and straightforward if you think about it. I mean, obviously, healthcare, doctors, pharmacies, dialysis treatments, chemo treatments, all that stuff is essential and must go forward. So yeah, that's all covered as an essential service.
Human service organizations, those are transitional facilities, services that help with physical, intellectual, or developmental disabilities. Again, and it includes their field offices and those employees too, and that's kind of a common sense one as well. Essential infrastructure, the road department, the railroads, public transportation, those all can continue, again, under the umbrella of following the same health guidelines. You mentioned the essential government functions. When you get to that, Mayor, let me ask you, what about the parks? What about, to the extent that Kinzer Park or Hardin Park, in the Cherokee National Forest has put in restrictions on accessing certain trails. The idea maybe isn't necessarily that you can't stay apart when you're in the mountains, but getting there with people that you weren't going to be with to begin with can be the issue. So what about, outdoor recreation that's been pushed and promoted a lot? This is a good time to get out, but that brings with it its own risks. So what are the rules or restrictions as far as that?
Well, what I've advised our park manager at Kinzer Park to do, again, there won't be any type of activities or reservations available for, pavilions or gatherings.
No picnicking. Can't picnic. That's already covered under the guidelines of safe distancing.
That's right. That's considered a social activity that's unnecessary, so that would not be allowed. For instance, people that maintain a seasonal camping there to the extent that they can comply with the CDC guidelines and social distance and that sort of thing, that would be permitted. But as far as any type of sort of social gathering, birthday parties, anniversaries that would be held at the pavilion, the pool, putt course, that sort of thing, that would not be allowed or permitted.
So, and again, this kind of, while I can keep my social distance, I can't really get 10 of my buddies together and go out for a flag football pickup game in the field at Kinzer Park, or, tossing the softball around or the baseball or kicking the soccer ball. All that's good. You and I can stay 10 or 20 feet apart. But if I'm getting 15 people together to do that doesn't help. And that's something that you just shouldn't do. If you want to go walk and hike by yourself or with your wife, husband, family, close family, people you're already in contact with, that's one thing. But calling up my buddies and saying, hey, let's all meet and do something, now you're kind of going against the grain of what this all is intended to do. Is that right?
And it's just not wise,
yeah.
Ron. I mean, that's the bottom line, is that people should make reasonable, wise, good judgments. And, doing those types of activities, as a large group like that, we certainly need to keep in mind that we all have to have an outlet for anxiety relief, right, and exercise and things like that. I'm a fairly large fitness nut myself. It's about to kill me that I can't go to the gym, but obviously that is not a very wise location to be with this sort of invisible threat floating around. So I have to find different avenues and outlets. So running at home by, mm-hmm, myself, taking a walk with my kids or family. People that I would, if I had to be quarantined for a period of time, that they would also most likely be quarantined with, right, me. But yeah, a pickup game or a gathering, just as a social to blow off steam, yeah, not a wise idea.
Only with people you would have been in contact with. Essential services continues. Number 6, food and medicine stores. That's grocery stores, pharmacies, farmers markets, produce stands, convenience stores. The retail sale of canned food, dry good, fresh fruits, pet supplies, all that is still considered essential. It's pretty self-explanatory. And the food and beverage production business. So that's farmers, livestock. Do you know, I don't mean to put you on the spot, but is the livestock market still open and transacting on Saturdays? Or are people still bringing their cows in for sale?
Absolutely. That would be considered an absolute essential activity. A lot of people might see that as some type of money-making venture, but that is most definitely an essential part of the food supply, agriculture industry that must continue. So the difference may be in the auction pit, instead of everybody sitting all together. Either there's some things that you just don't do. You can't sit together. Maybe they, I don't know how they do the auctions, but I've been in there before and it's a pretty big crowd. You can't have a crowd seeing those auctions anymore. Well, to the extent that's practicable, I mean, people should maintain, right, the CDC guidelines and conduct business in the safest manner possible. A lot of the calls, for instance, that I've received have revolved around people saying, well, Mayor, how can you sort of criticize, for instance, this activity that keeps us apart when people are standing on top of each other in Walmart and the grocery store? And there is certainly merit to that thought, but as far as grocery stores and shopping and those essential activities, those things must be done. So,
well, and the thing I think, Mayor, is that if I don't voluntarily do that, if I'm going to thumb my nose at this and say, well, by golly, I'm going to Walmart, I don't care how many people are there, then the next step is, I know this is placed or happened in like Knoxville, you get a number to sit outside in your car to wait to come into the grocery store. And that's only because people said, this doesn't apply to me. I'm going to go ahead and go.
Right.
So we can either do this voluntarily and smartly, or there'll have to be other restrictions put in.
That's correct.
Other essentials include organizations providing charitable services and social services, That would cover certainly the food bank and operations like that, religious and ceremonial functions. We talked about that. Gas stations, businesses needed for transportation. You can still get gas. I know Marathon is going to great extent to make sure their pumps are disinfected. They've got the hand sanitizer at all the pumps. They'll even pump the gas for you if you'll call ahead and say, I've got some concerns. Banks, financial institutions, it's a good time to refinance. The interest rates are low and banks are still working and doing that, but they're doing it a different way. And that's, again, the umbrella for all this.
Yes.
It's you don't just walk in now. Hardware, supply stores, including electrical, plumbing, and heating materials, all critical trades. I know somebody asked you about, I pour concrete, or I do lawn work, or I have my own business, and this is how I make my money. Yes, you can still do those, but practice the safe distancing.
That's right.
If I have a lawn care and landscape business, I can continue that. I just can't sit on the back porch with the neighbor or with the person I'm working for and share a glass of iced tea. Is that an accurate way of saying it?
That's very much an accurate way. We've probably had it. I've probably fielded at least 6 or 7 calls just specifically with people who do landscaping, plants, mowing. And mowing's a big season right now.
Right.
And
well, there are people that physically can't mow. They have to have that service.
That's correct.
Or they be,
But property maintenance and landscaping would be considered, an essential service. The advice I give those folks is, to the extent possible, have your clients or have your customers, either leave their payments in an envelope or at some agreed upon place. But not to socialize and not to interact. And for the most part, those guys are out doing their job. Guys and gals are out doing their job by themselves. Staying apart, going from residence to residence or business to business, getting their job done, and that's fine. Laundry
services, including dry cleaners, industrial laundry. We talked about the restaurants for off-premise consumption. Supplies for essential business and operations, including IT, telecommunications, hardware, paint, electrical, plumbing, all that. Transportation, vehicle services, home-based care services, residential facilities and shelters, professional services, including legal services, accounting. Accountants are still working. Lawyers are still doing that. The courts are kind of in limbo. They're holding things their own way. Again, all this continues under the safe guidelines. Hotels and motels. We talked about funeral services, and that it is a broad umbrella. It allows a lot of things to continue, but it urges using the safer at home practices. If you don't have to go to your accountant, if you don't have to go to the bank to conduct business, if it can be done over the phone, then that's what you ought to do.
Yes, I mean, we have many options: standard mail, internet, over the phone. For instance, one of the governor's orders waived, if you will, for a period of time, a period of 90 days, the renewal of license tags, driver's license and the like. So those don't necessarily have to be done in accordance with the way we've done them in the past, which is there's a specific sort of monthly or date deadline. You've got some adjustment there to, and you're able to do, again, we have, technology at our fingertips, and we have the ability to do these things in an alternate way.
We're speaking this morning with Greene County Mayor Kevin Morrison, and Mayor, I think that, that kind of, you can never cover it unless you cover it 24 hours a day, and we already know that that's happening, but appreciate your time coming down today. Is there anything we didn't touch on that you think we should? I mean, what about the enforcement of this? You mentioned earlier it could be a Class A misdemeanor. I mean, that brings in a whole other realm of how are you going to do that or what's going to happen, but at this point, you want people to voluntarily comply with this so that you don't have to start taking those other steps. And there are cities that, I think one in Massachusetts said they would fine you $5,000 if you were found in violation of that. We're not to that point yet here in Greene County, I don't think, but we don't want to get to that point either.
That's correct. Our community is not there. Mayor Daniels, myself, City Administrator Todd Smith, Chief of Police Tim Ward, the Sheriff, and I have had many conversations about You know, none of the civilian authorities, want to, force people or to power grab and take advantage. We want to transit this emergency, not take advantage or capitalize on this emergency. What we're trying to do is to keep people safe, and again, in as strong a terms as possible, urge people to do those things that, in my view, are common sense. It's not about restricting you individually to do the things that you want to do or go the places that you want to go. It's about protecting those that are most vulnerable. It's about the ability of this virus to have a tremendous catastrophic impact on vulnerable people. So
Right.
it's not about what you're doing, it's about what you're doing affecting other people. So we're trying to remind people, again, in graduated terms, other communities have taken a lot more drastic steps because their population is a lot more dense. Their situation is a lot more, I guess,
Have elderly populations,
in need.
or yeah,
Absolutely.
right.
We've tried to take very prudent, proactive steps to keep this virus away from those that are most vulnerable, to protect the jail and the prison population. So we're not going to start stopping people along the road and inquire of them, where you're going and what is your business. But for instance, when we do see, activity that is very much in the realm of dangerous activity, you may be, politely reminded, hey, think about this, and what you're doing here is in contrast to what the governor is asking, what the mayor or jurisdictional authorities are asking, and I'm sure, and I hope it doesn't get to this, that more stringent or more restricting measures, because that's not what we're about. And then, the last thing that we're a very strong faith-based community,
Right.
and I think that it is very, very appropriate to ask people to pray for your civilian leaders, that this emergency too will pass, and we'll emerge much stronger for it. So
I think that's the thing too, Kevin, that kind of gets lost in all this, the economy, and of course people are worried about their jobs, and there are things being put in place with the SAFER Act that Congress passed and the president signed, relief, on a massive scale. I mean, it really shows, I think, that the government wants to try to help people through this. I mean, to forgiveness of loans and things like that. There's some really things in there that you just wouldn't imagine. But it's just something that changes every day, and we'll just have to see how it goes. I want to go back. I may have opened up the can of worms, and I didn't really intend to. When I was talking about Kinzer Park, I was thinking more of the playgrounds, pavilions. I wasn't thinking much about the camping areas. But the national parks, Cherokee National Forest, all those campgrounds have not been open. They are still closed. Did you say, or do you know what the status will be of the seasonal camping there? Horse Creek has a camping area, but it is closed. It's closed by order of the Cherokee National Forest. Kinzer Park, is that just a county jurisdiction or a city jurisdiction?
That's a county jurisdiction. Okay. that we do. It's a lease agreement through the TVA that we operate Kinzer Park. Seasonal camping, much like the parks or recreational areas, for instance, in Johnson City and other places, would still be open to those people that have those seasonal campsites. But once again, much like an alternate residence or a second residence,
right,
you would still be asked to comply with the CDC guidelines as far as social gatherings, that sort of thing. Now's not the time to be going out and partying.
Well, that's the thing. You think about that. Yes, it's a second place to go and relax, but you can't go have the cookout with the neighbor next door. And I'm sure that's all subject to change too. This is a fluid situation, so that may
That's
change.
correct.
Well, Mayor, thank you very much again for coming. If let's give that number again. Heather Sapp, the EMA director, texted me just a moment ago that what you were talking about, the Greene County drive-through testing site opens today, I believe, and 9 till 11 daily. Do you have that number?
Well, there are
for the pre-screening for the health department here.
There are actually
three numbers.
Actually three, but the Northeast Tennessee Regional Health Office would be area code 423-979-4689. 979-4689. So if anybody is any resident is experiencing symptoms consistent with COVID-19, which I think you covered those, and we may want to reiterate those. Obviously, some type of persistent dry cough, a persistent low-grade fever, difficulty breathing, that sort of thing, should call one of those three numbers, the one that I just published, being the Northeast Tennessee Regional Health Office, and they would establish whether or not you meet the criteria to be screened, and then transit through our location here at the Greene County Health Department, just below the theater on 11E.
Okay. Ballard's listing there is kind of what you said. They'll ask about fevers, chills, sweating, difficulty breathing, new or worsening cough, sore throat, aching throughout the body, vomiting or diarrhea. And that's not to say that you have to have all of them, or that if you just have two, you necessarily have it. But, you know, if you've got a cough and diarrhea, that may be one thing. If you've got a fever and a cough and chills and aching body, that may be something else. Those are just the screening questions that they will ask as they try to triage and determine, yes, this person should take the next step. Mayor, the airwaves are always open for you anytime you need anything. Please feel free to talk to the public anytime you want. We'll be here. We'll do it any way we need to do it.
Well, Ron, our area media partners, and specifically Radio Greenville and WGRV, have been tremendous partners in getting the information to the people that need it most, in helping us to tamp down rumors and things like that, and get out the very most accurate story. So we certainly appreciate Radio Greenville, WGRV, and we will have more information and updates as they become available and are necessary.
And we will get through it all together.
Yes, sir. Thank you.
Greene County Mayor Kevin Morrison joining us in our studios this morning here on 99.5 FM WGRV, 103.1 FM WIKQ, and 95.5 FM The